Alpha blocker is a class of pharmacological agents that function as antagonists on alpha adrenergic receptors. Historically, alpha blockers were used as a tool for pharmacologic research to develop a greater understanding of the autonomic nervous system. In 1976, phenoxybenzamine was the first non-selective alpha blocker reported to be effective for the treatment of benign prostate hyperplasia. Prazosin was the first short-acting selective alpha-1 antagonist indicated for benign prostate hyperplasia. Then, 4 long-acting alpha-1 blockers have been approved by the US Food and Drug Administration for the treatment of symptomatic BPH. They are terazosin, doxazosin, tamsulosin, and alfuzosin. It is important to compare different alpha-1 blockers in order to determine their efficacy and tolerability, which are dose-dependent. In fact, the differences in both efficacy and toxicity may simply be due to different degrees of alpha-1 blockade efficacy. Indeed, doxazosin was the second long-acting alpha-1 blocker approved by the FDA. 2 clinical trials were performed comparing various doses of doxazosin. Cardura, a brand name for doxazosin mesylate, was approved by FDA on the 2nd of November in 1990. It was manufactured by Pfizer, an American pharmaceutical company. Meanwhile, Cardura XL was approved by the FDA on the 22nd of February in 2005. It is an extended-release formulation providing a controlled release of doxazosin over a 24-hour period.
Next is the main clinical indications or therapeutic of doxazosin.
Doxazosin is a selective alpha-1 adrenergic receptor antagonist. Its main indications are to treat mild to moderate hypertension, to treat benign prostatic hyperplasia, and the last one is to relieve the discomfortness caused by ureteric calculus.
Next, we will compare between drugs in treating benign prostate hyperplasia. The first one is phenoxybenzamine, which is a non-selective alpha blocker. The second one is prazosin, which is a short-acting selective alpha-1A and alpha-1B blocker. As it is a short-acting drug, it is administered in a high dose and thus inducing a high first dose effect in the patient. The third one is doxazosin, which is a long-acting selective alpha-1A and alpha-1B blocker. As it is a long-acting drug, it is administered in low dose, thus contribute to the low first dose effect in the patients. The last one is tamsulosin, which is a selective alpha-1A blocker. Because of this, tamsulosin is the best drug in treating benign prostate hyperplasia because it only blocks specifically alpha-1A adrenergic receptor. The first dose effect are orthostatic hypotension and dizziness.
Besides that, doxazosin and terazosin, example of alpha blockers, are used as first-line agents in male patients who have both hypertension and lower urinary tract symptoms.
Next, we are going to discuss on the medicinal chemistry of doxazosin. First, we have to know the chemical structure of doxazosin, which are 2,4-diamino-6,7-dimethoxyquinazoline. It is a bioaccessory replacement of norepinephrine, so it will involve in the binding at adrenergic receptor. The methoxy will act as a hydrogen bond acceptor of serine 207 and 203 at transmembrane 5.
Next is piperazine ring, which is responsible for selectivity at alpha-1A receptor. However, in prazosin, the removal of this ring did not affect much. And finally, the benzodiazepine ring, which is responsible for lengthening the half-life of doxazosins. Furthermore, the chirality at carbon 3 of benzodiazepine affect the affinity at alpha-1 adrenergic receptor, although the difference is not much, as doxazosin exhibit higher affinity compared to R-doxazosin. This is the crystal structure of adrenergic receptor where the drug will bind. Phenylalanine at transmembrane 7 is non-selective for alpha-1, meanwhile phenylalanine at T6 at transmembrane 2 is responsible for alpha-1A selectivity.
The norepinephrine will bind to the alpha-1 receptor. However, when doxazosin present, it will block the alpha-1 receptor, preventing norepinephrine to bind to it. It will bind to alpha-1 receptor, then this will inhibit the pressure effect and systolic effect of phenylephrine and norepinephrine, then this will cause vasodilation, reduce peripheral vascular resistance and reduce blood pressure.
In arterioles, doxazosin decreases total peripheral resistance (TPR), reduces afterload, hence venous return is also reduced. Meanwhile, in veins, doxazosin decreases preload. This increases venous pooling, hence decreases venous return to the heart. Since doxazosin reduces both cardiac preload and afterload, consequently, it reduces left ventricular wall stress and myocardial oxygen consumption. Reduced blood pressure is then achieved.
The main adverse effect of doxazosin is the first dose effect. The first dose effect is divided into postural hypotension, dizziness, and fainting. Doxazosin is a long-acting agent, so when the low dose of doxazosin is administered, it can minimize the first dose effect. The first dose effect occurs when the doxazosin blocks the alpha-1 receptor, and vasodilation in peripheral blood vessels occur and body will have a pure ability to control the blood pressure. Therefore, systemic arterial blood pressure will fall by more than 20 mmHg upon standing. This condition called postural hypotension. The next one is when the patient changing from the supine to the standing position, the gravity tends to cause the blood to pool in the lower extremities, and the cerebral perfusion fall or syncope occur as the low blood flow to the brain. Then the dizziness and fainting occur. As we know, in the first dose effect, the blood pressure will drop as the postural hypotension occur. After that, the body will undergo the hemostasis process, which the body will increase the sympathetic tone. Therefore, the reflex tachycardia occur in order to increase the blood pressure to the normal condition. Next, the other common adverse effect of doxazosin is on musculoskeletal system, which are myalgia and back pain. Meanwhile, on the gastrointestinal system, the adverse effects are abdominal pain and nausea. The next common adverse effect of doxazosin is on respiratory system, which are dyspnea and rhinitis, and the last adverse effect of doxazosin is on sexual system, which are priapism or painful erection and sexual dysfunction.
To sum up, we agree that doxazosin could cause postural hypotension and first dose effect. However, the characteristic of doxazosin as long-acting alpha-1 blocker and the fact that it is given at a lower dose helps in minimizing the risk of first dose effect compared to other types of drugs. For example, there are a few drugs that causes postural hypotension, mainly antihypertensive drugs. We could compare the first dose effect of doxazosin with, for example, prazosin, a short-acting alpha-1 blocker, metoprolol, a beta blocker, amlodipine, a calcium channel blocker, and captopril, an ACE inhibitor. They are all antihypertensives. From this table, we can see the postural hypotension effect with different types of drugs. As explained earlier, doxazosin has a lower risk of postural hypotension compared to other antihypertensive drugs due to its long-acting property. Lastly, There are many factors that took part in determining the risk of first dose effect of these drugs, such as the half-life, duration of action, bioavailability, drug dosage, and metabolism rate of the drug. That's all from our group. Thank you for watching. Bye!